Join me as I help soften the appearance of this beautiful patient's lip lines, smoker's lines, barcode lines, whatever you want to call them, those pesky lines that we as injectors find so frustrating to treat sometimes. So for this patient, I chose to use Bellatero Balance for this treatment, and I'm using a 30 gauge by 1 inch needle. Now for this patient, what I'm doing is placing incredibly superficial retrograde injections in the Ergotrid, which is that area above the pink part of our lip, or what we consider the white part of our lip. So you can see I want that 1 inch needle to be able to span the entire Ergotrid without doing too many pokes. So I place my needle very superficially to the point where you can almost see the gray of the needle. I'm pushing all the way to that filtral column, and then I'm retrograde injecting, placing a nice thread of filler. And with Bellatero Balance, you can do this because it's gonna lay like a beautiful blanket. Now I tell all of my patients, expect bruising. There are a lot of fine little capillaries, a lot of fine little vessels in this area. Every patient will bruise. If you don't bruise, congratulations, that's a gift. But I always tell my patients for this particular treatment, make sure that you're planning for bruising. So I'm laying nice retrograde threads throughout the Ergotrid. You can see this is the pattern that I'm taking, and now I'm going to go perpendicular to those lines that I just created and cross hatch. So now superficial threads, you could see right there how superficial I am. You could see the entire outline of the needle. Inject all the way to the filtral column, and then retrograde inject, pushing product as I'm coming out, and I continue my way down that Ergotrid. This is called the Adore technique. It was developed by Dr. Danny Soares and myself. We have a beautiful publication that I'll link below that you can read, and it comes with a great video. But this is the technique that we use to tackle these lip lines. Our patients typically have this treatment performed about once per year because the results last that long. With a product like Bellatero Balance, you can't go wrong. You really want a nice, fine product, but with decent longevity so that they're not coming back in quarterly. So I'm just laying small retrograde threads. Now, what's important for this treatment is that you need to make sure that the patient has room or a deficit in their Ergotrid to warrant adding any bit of filler. Because even though we're adding a fine filler, a thin filler, you're still adding filler. So if they have a good amount of dense tissue there, they're not going to qualify. So I always tell patients, just because you have lip lines doesn't make you a candidate for lip line filler. You want to make sure that they have a nice deficit in that Ergotrid to have space to add filler. If not, you're going to make them look like Homer Simpson and you're going to round out their upper lip. So I spend time really massaging out that product so that it blends beautifully. She's going to be swollen, she's going to be puffy, but it's going to settle beautifully. Now I'm going to move on to injecting her lips. For this, I'm using a 31 gauge 8mm needle, the insulin needles, and I'm placing small retrograde linear threads, creating height in her lips. She has a beautiful shaped lip. I really love injecting lips with lip lines. I feel like when you add a little bit of volume in the lips, it really gives structure to the volume that you added in the lip line or the Ergotrid. So I'm just placing small retrograde linear threads. I always have a little bit of alcohol on my gauze to make sure that my area is being cleaned over and over and over again. So small retrograde threads. If you're ever interested in full lip technique and how I tackle lips, I have a beautiful lip guide that has 15 videos of step-by-step lip filler injection techniques that I'll link below as well. But just adding a little bit of hydration to her lips, look how pretty she looks. I mean, she is such a dear patient of mine. I see her once a year for this treatment, and she is just a doll to work with. She's so jolly. I adore her. So just placing small retrograde threads, trying to evert that lower lip to make sure that I get a little bit more show for her because she is a little more top heavy. And now just putting the finishing touches on that. I always love to do this horizontal thread here because you never want to add height or evert the lateral part of the lip too much because it just makes them look wide. So I'm going to spend some time massaging. That's Vaseline on my glove if you were wondering what that was. I always have a little bit of Vaseline ready so that I can massage their lips and just blend all that beautiful product together. And here are her lovely results. She just looks refreshed and rejuvenated. You could see on expression and animation how much those dynamic lip lines really changed and transformed. Now she's bruised, she's swollen. All of this will settle beautifully, and I know I'll see her next year for her treatment again.